Airway clearance therapy is a way to help mobilize secretions from patients' lungs to help them to live a healthier, more active life. When they do their airway clearance, they're able to breathe better, to feel better, to do the things that are so basic for everyone else to do. Huff coughing is a way to produce mucus. So it's a way of taking a deep breath in and then expelling that air fast. So it's something like this. Active cycle breathing is a way that a patient would take deep breaths and focus on getting more air into their lungs. So when you do active cycle breathing, you focus on sitting up straight, putting your shoulders back, taking a deep breath in and exhaling, and then putting your hands on your rib cage. Deep breath in and exhale again. Focus on pushing your diaphragm down and allowing more air into your lungs. And after you do a couple of those nice, deep cleansing breaths, you would huff cough, and that would help to boost that mucus up and out of your airway. Exercise is very important because many people prefer different ways of exercising. It helps you because you are getting in different positions. You're taking big breaths. You're moving around and really mobilizing those secretions within your lungs. CPT is a great method of removing secretions, but you tend to need another person with you. That other person will clap their hands and they will create a percussion sound on your back in different areas. And that clapping will create the vibration that moves the mucus up and out of your airways. Postural drainage is positioning that allows you to get the mucus out from different lobes. So whether you're sitting up or you're laying down or you're laying at an angle, that will help that mucus move out of those distal airways and up towards the larger airways. Bronchodilators are great ways to help to relax the smooth muscle. The bronchodilator helps to open up those airways, relax that smooth muscle, allow the hypertonic saline to get deeper into your lungs. Hypertonic saline is a high salt solution, and that high salt solution does a couple of things. It helps to add moisture to the airways. It also is an irritant, so it helps to create that bronchospasm that creates that cough, which helps you expel those secretions. Positive expiratory pressure devices are a way of having a tool to help you to take that deep breath in. You will put your mouth around a mouthpiece and you will breathe in, hold your breath for a couple seconds, and then exhale into a device, which will create a back pressure within your lungs. That back pressure helps to force that air behind the mucus so that when you huff cough, you can get the mucus out easier. Oscillating Pep Devices are a step further than the regular PEP devices. They add the vibration behind the back pressure. As the air enters your lungs and your lungs expand with the air, it creates a fluttering valve in which breaks that mucus away from the airway walls and thins it even further so that when you do huff cough, it is easier to move up and out of those airways. There are two different types of high-frequency chest wall oscillation devices. One is a tethered device that you would plug into the wall and you would sit stationary at a chair to do. You would put the vest on your body and you would sit there for about 20 minutes twice a day. The other option is a non-tethered device in which it's battery powered and you have a remote, and this allows the patient to do other things inside their home or outside their home if they so choose, and still do their airway clearance. And it's easier to pack and travel with also.